We do have an exciting announcement at this conference that you're going to hear more than once because Lori's excited about it. She mentioned it. I'm excited about it. We are releasing the National Respite Care Provider Training Replication Toolkit at this conference. You've got a flyer on it as part of your handouts this morning and a rack card in your registration material. And we're so fortunate that I have our partners here that worked on the development of this training, on the development of the core competencies, on every aspect, on the evaluation. And you're getting a sneak peek at this today. They're doing another presentation later. Is it tomorrow? I think tomorrow that will go into more depth on the evaluation data, but you're getting the first peek at this and a chance to ask questions about how your state can get involved in this if you'd like to. So I'm going to turn it over to Lisa Schneider and Kim Whitmore, who are going to share everything they know about the provider training and the pilot test. Let me pull up the slides.
And we did not get the sparkly shirt memo.
No, we didn't. We missed it.
We are equally as excited, though we don't have a sparkly shirt. Next time.
Voila. Well, we learned the power of an asterisk, so that's my tip for today. Hi, everybody. I'm Lisa Schneider. I'm the Executive Director of Respite Care Association of Wisconsin, and really happy to talk to you today about the National Respite Provider Recruitment, Training, and Retention Project that some of you played a role in, and talk about small steps. This was a 3-year project in the making, and we're really happy to share with you today the results of that project. So I already introduced myself to you guys, so my colleague here, Kim, will do hers.
Hi, everybody. I'm a little taller, so I gotta move that up. I'm Kim Whitmore. I'm an assistant professor in the College of Nursing at Marquette University, and very fortunate to have the opportunity to work as the evaluation consultant on this project and support a lot of ARCH research-related initiatives. So if you're a research and data nerd, come find me and talk to me.
I have Jill to thank too for this collaboration here, because when Kim submitted to present the National Lifespan Respite Conference in Wisconsin pre-COVID, Jill introduced the two of us together, and we have been friends ever since and have worked together. We planned that conference 3 years in a row, though, and only held it once. So back to the project. So we were really excited about this project. This was originally started that RCAW, which is Respite Care Association of Wisconsin, had a training program. It was 10 courses, and we had been doing it for multiple years, almost 10 years. And we kind of had the idea of, everybody was doing their own thing, and we wanted to create a universal national set of curriculum so that we can all be kind of doing the same thing. And also when you talk about data measurements, how do you measure data when you're doing different things? And so this was a way to really kind of tie things together and roll things up. So for the most part, we wanted to also field test this as well, because we wanted to look at the courses that we had, look at improvements that we need to make, but we wanted to field test it so that we had an evidence-informed training practice that we could roll out on a national level. So we did this, and we wanted to learn about and develop an innovative and specialized recruitment campaign as well. We won't go into much detail on that, but when we go into the toolkit that we're going to unveil today, you'll see there's some more in-depth stuff on there. But I will say one of the biggest messages in our recruitment campaign, or I should say there's two of them, is it will not happen on its own. It does take a lot of work and commitment. And two, we want to bust that McDonald's mindset. So you always hear the argument of people wanting to, who's going to come and be a caregiver when you can go flip burgers for $15? Well, these are not the people you target in a recruitment campaign to become a caregiver. Just a heads up on that one. So the steps to the project completion that we had, again, was to look at developing entry-level core competencies and making it universal and also customized. Well, we'll get into that in a little bit. I'm getting a little bit like Lori right now. We also wanted to enhance so that we would align the training curriculum with the core competencies. And Kim's going to talk about a little bit more about the core competencies and how they were developed. So this is just the steps we took. We strategized our recruitment and marketing campaigns, so those that participated in the pilot project were all part of a comprehensive training series that we went through in regards to kind of mind shifting on how we go about doing recruitment and marketing. And then we wanted to pilot the project for 12 months. Talk about baby steps, oh my God. So this was a 3-year project in the making, and we did a full 12-month year worth of piloting the project. Then came the evaluation part that Kim really played a significant role in, and that took a good chunk of the 3rd year because there was a lot of data to collect, and you guys collected a lot of information, also a lot of lessons learned that we will also be showcasing in a little bit. So with all of that combined, the culmination of that became our respite provider toolkit that we training toolkit that we'll be unveiling to you along with lessons learned. So we hope that you will be excited to see that.
Thank you, Lisa. So I'm just going to talk a little bit about the core competencies. So this was a really exciting opportunity to establish for the first time nationally recognized universal core competencies for entry-level respite providers. So how did we do that? We started by forming an expert work group. So this included many people at the national level who worked with different organizations, but also people who duly wore that hat as a caregiver to ensure that this was also informed by caregivers as well. And you can see the list of all of those people on the website. So if you're interested in who was on that expert work group, is there people in here that were on that expert work group? Yeah, Kathy, I think. Anyone else? Thank you, Kathy. So talk to Kathy about her role on the expert work group. And then what we did is we actually did a crosswalk. So I conducted an environmental scan and tried to find all of the core competencies that were out there that were related. There wasn't a standard respite core competencies, but looking at CNA core competencies, Medicaid core competencies, any reports or articles that were published about what does a respite provider need to know to be a qualified, high-quality respite provider. So we crosswalked that, we made a matrix, we had multiple conversations about what we liked about those, and then we sort of respitized it. So we adjusted the language to ensure that it was really clear when you read these core competencies that this wasn't just core competencies for a caregiver, these were core competencies for a respite provider. And again, you can take a look at the list of all those core competencies at our website as well. And as Lisa already mentioned, once we had those core competencies established, we then crosswalked that to the training, made sure that the training was driven by those core competencies. So we integrated pre-post questions that assessed people's comfort level with those core competencies so we could measure how people improved in those core competencies from before and after taking the training, and ensure that the course content that was refreshed and updated based on these core competencies really achieved those learning objectives to meet those core competencies as well. I want to back up. I missed a bullet. I didn't have a star by it. That's probably why. We also disseminated the initial draft of these core competencies very broadly, so hopefully many of you received the request for public comment on those core competencies and provided feedback, and we got lots of feedback on the original draft of those core competencies, which we then used to edit and finalize those core competencies. So this next slide, do you want to do this one or do you want me to do this one? Okay, so this next slide just gives you some information about how to review what those individual courses were in the training. So if you aren't familiar with the training, I encourage you to take a look at that. We have some links and websites here that help you see what those different courses are. In the pilot, states that were part of the pilot were also able to add their own state-specific information to some of the content to make sure it was customized for their state. So in particular, anything around how to become a respite provider, how it's funded, any liability issues that may be unique to each state were able to be updated and reflective of the state-specific information. So we encourage you to take a look at the course descriptions. The training modules are on the webpage. And then what's really exciting with funding that wasn't part of this initial project, but through the Respite Care Association Wisconsin Lifespan Respite Grant, we were also able to get this course translated into Spanish, which was huge in helping to reach a population of caregivers and respite providers that is very underrepresented and served in our communities. So it is now available in Spanish, which is really exciting to be able to share. And I'll pass it back.
So with the, just to say, with the training courses, with the 10 pilot projects, we were able to do the state-specific add-ons, if you want to say, or incorporations. But we saw a lot of people from other states that were not participating, and even at the international level that were taking it. So we decided to just create a national, no state-specific training, and that already exists on RCAW's website. So people, you can use this training just at the national level with no state-specific training. I just wanted to add that, and that is also in Spanish. So, so right now we've got. This is just an example of how you can market the training that we have. We really try hard to say that this is entry-level training. This is not a CNA level training. This is a step towards that training for people to get some initial experience, because many adult family homes or home and community-based services don't necessarily provide CNA type services. We want them to be trained in regards to, again, some of the things that mean a lot to us are making that respite meaningful and person specific, but also to be aware of what all is included in what we term as respite care. So this is just a potential career path that people could take, or they could stay continuing to be a respite care provider, because it is very rich and rewarding. And then this is just a high-level overview of matching the core competencies with the core training course itself. So it's just probably a Cliff Note version of what Kim just presented. So these are the states that participated in the pilot project, again, 3 years in the making. Are there any people here today from the 10 pilot sites that were with us? If you guys want to stand up. Yay. This was like a once-in-a-lifetime project, at least on our end, and we kind of went into it all on the same page, because it was just a new endeavor, and you guys were such troopers. What was really nice is we met monthly, I think, throughout the process, and so everybody had input, so it wasn't just us steering it. It was a whole collective effort, and I think that's why this project turned out so beautifully, with the data that we collected, the lessons that we learned, and the product that we're about to unveil.
Okay, so I'm going to give just a little teaser about the project evaluation. If you want to learn more about the evaluation and what we found, you need to come to our session tomorrow at 11 a.m. so you can have more details about the evaluation. But as a high-level overview, it was really important for us to evaluate this project at multiple levels. So at the individual learner level, we wanted to know how people who took this course did. Did they like the course? Did they meet the core competencies? Did they increase their confidence? Did it make them more likely to provide respite care? Those are some of the things we assessed in our individual evaluation of people who took the course. We also wanted to know at the agency level how this worked. Was it easy to incorporate this training into their workflow? What barriers did they encounter? What made it successful in their state? And then the overall project, just to ensure that we were meeting the objectives of the overall project. So we did a multi-layer evaluation, and you can learn a lot more about that tomorrow. So for our time today, we really wanted to be able to showcase for the first time ever, I feel like lights should be shining and like there should be a drum roll. We want to feature and show you the online toolkit. So just before we pull that up online here, if you want to, this QR code here, this will get you to the landing page that has the existing trainings that are available now. So the state-specific trainings from the pilot, as well as that national training that is sort of generic and any state could use it. So if you are not already using this training and you want to, There are existing ones. You can direct your potential respite providers and families to this site. They can take the training. It's free. Please do so. The toolkit is designed so if you want to create your own version of this training that is state specific or program specific, or you want to have elements of this training in some way, it's handing you the information to help you replicate this training with some caveats on what you can call this training depending on how you package it. You're definitely welcome to take pieces of it, but if you want to say you have a evidence-based, evidence-informed national respite care provider training, you kind of have to take it as the whole package. So there's language in there for that. But if you just want to use the training that exists and take advantage of that, this is the QR code for you to scan. This QR code is what you all want to scan right now. It's also in your fancy flyer that I feel very proud of because we spent a lot of time on this fancy flyer. So if you didn't already notice, you have this beautiful, I feel like Vanna should display this. Maybe Lori should come up here with her sparkly shirt and highlight. This has an overview of the project, and it also has the QR codes to request access to the toolkit. So how the toolkit access works is you scan this or go to this website. You will fill out a short survey that tells us who you are, why you want the toolkit, and that you agree to the terms of use of the toolkit, so that we can have a little bit of ability to not restrict who uses it, but information about who uses it, again, for continued data collection. So we have the ability to track how it's being used, maybe reach out to you to survey, see how things are going, see what else we can do to enhance it. So if you want access to the toolkit, you need to scan this QR code or go to this web page, fill out the survey, and then you will be reviewed, your request will be reviewed, and then you'll be sent the actual link to the toolkit to use. We do ask that you don't share that link unless it's within your own project team. So if somebody from another organization or another state says, ooh, I want the toolkit, please give them the request QR code or on the flyer, because again, we want to be able to track their access too. So we know you'll be really excited and want to share this with everybody you know, but please don't share the actual toolkit webpage, share the request survey. Any questions on that? Okay, so now we're going to have this dramatic pause while we pull up the web page to show you. So we'll take like a minute to do this probably, so feel free to, build the excitement here. So let's pull this up.
Griswold drum roll.
You just open a web. I can just open a web browser. For your intermission entertainment, we have Lori in her sparkly shirt. Oh, I just need a web page. Oh, you got it saved?
I had it, but I don't know why it's not coming up.
Here, I'll just go to
It's just taking a while.
Is it? Is it? Oh gosh, okay. Uh-oh. Now we need tech support to help us share our website screen. Oh, there we go. Okay. It was just really being dramatic. Okay. So, introducing the National Respite Care Provider Training Toolkit, and I'm going to start by just walking you through the executive summary, and then I'm going to pass it off to Lisa, who's going to share some of the other content. So just some features on this website that we want you to be aware of. For navigational purposes, there is a toolbar on the left side that has all the different sections of the toolkit for reference. The home page just provides a very brief overview of the toolkit and a little teaser about the project. And then you can click on these icons for the major sections of the toolkit. So we have our executive summary, a section on assessing readiness, the actual course content. So in that is all the slides that are part of the training. We have the marketing and recruitment resources, the evaluation. Again, we would encourage you to do your own evaluation if you're doing this again. And then, of course, our disclaimer for the funding and project partners. So on the executive summary, this is a lot of what is in that flyer that you guys have. So it provides, again, the background on the project, a little bit about the core competencies with all the links to see that information. It has the course descriptions, describes the pilot sites, so shouldn't be new. You've all heard this, and it's on that flyer. And again, we encourage states that are interested in implementing this or developing their own state-specific training to utilize this toolkit. So I'm going to pass it off to Lisa, who's going to go over assessing readiness and the course content. Yes?
Yeah, something like that. So, were you using the mouse to scroll? Yeah. Okay. So that's good. All right. So anyway, so we, as Kim said, we broke this out into core areas of things that we hope that you guys will go through and making sure that this is the decision that's best for what you guys want to accomplish. Because so we've cut out a lot of the time of having to do all what we did over in 3 years, and this is the summation of it. So when you're wanting to assess readiness, there's these high-level categories, but you can click on these drop-down boxes, and there's a lot more information. When it comes to assessing readiness, some of the key things that we talked about was organizational buy-in. You want people to buy into the training that you are going to be releasing because, again, it does take time and effort in order to make it successful. You also need to have the capacity to go through the project and to be able to carry out what takes some time. So you need to kind of, here are some questions that you can ask yourself or your group, hopefully, about evaluating whether this is a good time or a good project for you. There's some tips in this little section right here that you guys can consider. There's also technology needs that you might want to consider. We have learned that, I'm going to say that for the lessons learned. So to also explore funding, how you're going to support this, and I'll tie a little bit of that in with how we're going to go about with the replication toolkit, because the way that you guys can use this, it's very cost effective. And there's a couple of ways you can go about it. And we'll talk about that towards the end. So sometimes funding is not going to be a super big issue if you've got, let's say, the systems in place to do this. So, I'm getting ahead of myself. You also want this training to be connected to connecting trained providers to families. So this is where a registry or something like a registry is really key. We did learn that during the pilot project that when people were not as incentivized to go through the training if you did not have a way to match them up with a provider who was, or a family caregiver who was looking for care. To also look at the ways to sustain your project when you want to implement this in your state. And we kind of created an assessment readiness tool that you guys, this is clickable, you can download it. I won't do it right now because I don't want to fear not being able to get back to here. But it's a pretty comprehensive tool that we can document, so you can work with your group, your project team or whatever, and walk through the process and then kind of see maybe your green areas are go, your yellow, whatever, however you want to do it, or your 5s are stop and your 1s are go. It's just a way to kind of culminate your thinking process in regards to assessing your readiness. Again, each of these sections will have a little part at the bottom that talks about lessons learned. I would really pay attention to these, so when you go through each section, take a look at the bottom, because this is feedback from all of the 10 pilot partner states. And so it's something that a lot of you will experience, and this will be some helpful tips that are in there for you to consider. The course content is really like the meat of the project. It is what you want. And so the course content is made up of 10 different courses. And Val here has, we've created just an overview of the training content. So it's just kind of like what we've talked about earlier about how the content came to be, the steps that we took for incorporating the core competencies into the training. and then matching up the training with the core competencies. And then we went about implementing it. So again, a lot of this we talked about earlier on. And then there's, we created within the slides that are kind of static for the most part, but there's some slides that are specific where any state that wants to partake in this process, you can add state-specific training requirements that you want. What was key for us is Respite Care Association already used a third-party learning platform. There we go. And so throughout the pilot project, we were able to use our third party, so the pilots didn't have to pay anything to participate in this. And actually, the grant has funded it, so they haven't had to pay for it for almost 2 years now. But it's very reasonable. So the way of working together is another way of being more sustainable as well. But the learning management system is where all the courses are housed. And this is how we do it. So this is not something that you have to do. And we'll talk a little bit about that. But this is kind of where that little nuanced shift or pivot comes into play, because the way we did it through the pilot is the states worked with RCAW. We housed all of the 10 different states training on our Talent LMS third-party platform. And then people, and it was customized with their own landing page, so it looked like it's theirs, but it, the URL still had our stuff on it. But it was access to your own data, your landing page, your training, so it was yours, and it worked really well. And that's how we did at least the pilot project. It is a project that you can also look at the core curriculum and offer it in person. So this is an option. Now, if you want to, as Kim said, call it the National Lifespan, National Respite Care Provider Training, that you need to follow the courses as a whole, or otherwise you cannot call it. It doesn't meet the core competencies, or it may not meet the core competencies in order to promote it as such. So, so it does give you the option, or normally it's been online, but you can do an in-person or virtual training. I'm not gonna go, there's just some terms and conditions of use that you can read at your leisure. And then we talk about the course materials and how to, getting to the chase, accessing the course materials. So these are the actual courses that once you do your QR code, you email us, we'll send you the link to this page. This is where you would go to download your slides. And you could download it onto a platform of your choosing, or you could work with RCAW and say, hey, I just want you guys to put it on your third-party platform, and we'll send you our state-specific slides. Or you can do other things, but you may not be able to call it the National Respite Provider Training. Does that make sense to everybody so far? Yes.
So on these are all icons, so if you click on these, it's actually going to take you to the page that has links to all the materials, both in English and Spanish, for each of the courses within the training. So it's all here, downloadable, so that you literally just, we're handing you this beautiful training to use.
Thank you. I was too afraid to click in more links just in case.
Don't be scared.
All right.
There you go.
So the one caveat, though, is that if you do access the training, because it was done, with blood, sweat, and tears, but also some federal funding, that it needs to be offered for free. So this is free to the learner. So it will always be free to the learner. Now, if you work, let's say, with RCAW, you maybe charge a small, tiny little amount for just the cost of accessing the Talent LMS. There's no profit on it. And it's like $50 a month. So if you wanted to save a lot of money and get free training, it's worth $50 a month. However, you could house it on your own access, on your own learning platform, however you want to set it up. So there's a myriad of ways of doing it, but the catch is not changing it and calling it the National Lifespan Respite Provider Training. Again, some lessons learned in here. We do want to be clear that this is, it is not high on the medical side of things, so it's just, we always say that if somebody got stung by a bee, you'd still administer, an EpiPen to them. So that's like the extent of what we're talking about when you're providing respite care. There's different trainings that can be for more comprehensive training needs, but again, entry-level training. And I'll do the marketing and recruitment too. This is a little bit of what I touched base on. Again, if you don't market, you're not going to have many people come to your training site. So it's really great to cast a wide net and find partners that will become part of your system to maybe refer people to come and take your training. I talked a little bit about busting, that McDonald's mindset, and the 10 pilot states that did go through this, we did have an expert, subject matter expert that brought us through, I think, 4 or 5 different workshops online about how to go about marketing. And there was a real comprehensive process that is touched on in this toolkit, so you can get more information in here as to how we went about that. But again, I just want to emphasize this. It doesn't just happen. You need to put forth the effort, but it pays off, because once you develop that system where people are referring, whether it's institutions of higher education, technical schools, area agencies, anybody, you establish that system, people start coming. And so there's some examples of some of the promotional materials that were used, and then here's some pictures of what was used with the various states that we had. And I think there's information in there on how they disseminated it and stuff like that. And then once again, lessons learned in regards to the marketing and recruitment.
Yeah, and I just want to emphasize with the marketing, I think we heard a lot, we just thought, we're offering a free training, why wouldn't people just take it? So it's that if you build it, they will come, did not work. So it is so important to identify partners, build relationships, sustain those relationships with those partners, because it's not a one and done. It's continuing to let people know about this training and targeting the right people who are going to help feed people into your trainings platform as well. So for the evaluation section, again in here, we provide a little bit more detail about what we recommend for evaluation. We describe what's already built into the course. So again, you would also have the survey questions, like if you were to take this training and do it in person, you could replicate our pre-post survey. We give you all the questions and response options for those surveys. The post-completion survey, again, we want to try to continue to collect data. We have the questions that we used for the agency level. A lot of that is based on the RE-AIM framework, which is an evaluation framework that helps us understand how easy or hard this was to actually facilitate and implement, and it's a good check-in, self-check-in for you as an agency if you're going to be replicating this as well. We also did a 6-month follow-up survey just to see how learners who took this course were doing 6 months later. Were they actually providing respite? Did they feel the training prepared them for that? And then for those who didn't complete the course, so if they started the course but never finished it, we did an inactive survey. So again, that's something you could implement as well. Again, this just talks a little bit more about the RE-AIM framework for those who want to learn and geek out on evaluation a little bit more, and then our lessons learned. And so from there, setting realistic goals, I think, was a big lesson learned. People were like, we're going to have 5,000 people take this training. And then the first month they had like 3. So it's really important to take those baby steps that Lori talked about and celebrate those. And I think from states who are part of that have seen it takes a while for the word to spread. And once it's out there, then the numbers keep coming. So, we've had over 1,600 people complete this training to date, which is amazing, right? And those numbers are continuing to grow. So again, tips on evaluation here for you to replicate. And then the other sections that I just want to highlight, again, the terms and conditions of use. This is really important, again, that if you are taking this, you're agreeing to take it as a whole or not call it the National Respite Provider Training. And so really important that you pay attention to that, and when you fill out that survey, you'll be agreeing to that as well. So we have the acknowledgments of all the amazing people who helped make this happen, all the, here's our expert work groups as well on there. So I think that's the last section, and the website's going crazy. There we go. Then we just have a contact us. So if people have questions or running into issues about the training, they can reach out to us. So that is our fancy website that we spent a lot of blood, sweat, and tears putting together. We hope it's really useful. We, again, thank the pilot sites for helping us have this be really informed by the real life experience they had doing this. So a lot of what we recommend in the replication toolkit is based off your feedback of what worked, what didn't, so that others don't repeat those same mistakes. So with that, I'm going to pass it back over to Lisa, who's just going to lead us through a discussion, talk a little bit more about how your state could get involved, and then we'd love to hear, in the time we have left, if there's any pilot states that are in the room that want to share how it's going, for those of you who are continuing it, or just kind of your 2 cents on the pilot project as well. So thank you.
So first of all, what I want to share with you is there's a rack card that many of you have received. And so you wonder, like, how am I going to, talk about this when I go back home to my state to say, hey, I want to do this. You can also take this. What's really nice is they're neutral. So, it does not say Wisconsin's National Respite Care. It is National Respite Care Provider Training. So you can share this brochure. And then you can also, like, if you're wanting to just, again, inform your state, your agencies, or whatever that want to explore this, we will have this card available either on the RCAW website, and Kim and I were just talking that we could maybe add something to this website that if you wanted to download or order some of these rack cards to promote the training for people to take your training in your state, that you could go ahead and use this as well. So there's just some tools for your resources. But I know we threw a lot out at you guys, and I know you probably are thinking of different ways that you can use this in your states, and I guess, how much time do we have? Like 10 minutes? 5 minutes? So with any of the states here, do you have one thing that you would advise to anybody who's looking to maybe consider doing this? Is there a state that wants to stand out? There we go. Awesome.
Gotta wait for the mic.
Thank you. Hi, I'm Tina. I'm from the Illinois Respite Coalition, and I think the first thing I would say, for us, it seemed overwhelming, and it was. But the support and how organized it was, I'm so proud that we were a part of this, and we're growing. And I was talking to both of them last night, and I said, I had a special ed teacher who contacted me, and she said, I'm tired of hearing families not finding workers. And they get the funding, right? That's half the problem, is finding the funding, and then they can't find workers. And she said, can I meet with you for this training? So I met with her and some parents, and then she got together volunteers in the community, and it's a rural area. So right now we have volunteers from the community taking this training to support the families in their community, and I'm hoping this is going to be the next step for us to hit the other rural communities and say we have a success story here.
That's a great story, and I think it's an example. You guys, maybe you don't remember, but those old Breck commercials, when you tell someone and they tell someone and so on and so on. Maybe that's really old, but that's how it works. It grows exponentially. Adrienne.
Hi, Adrienne Smith. I'm from New Mexico. We too got just great support. It was a long year. It felt like a long year, but there was so much back and forth and so much support. I'll say I think that the marketing was probably the toughest part for us, but somebody came up with an idea of approaching yoga studios and yoga teachers somehow, and that was fun. I mean, you just never know what people are going to say is successful. Yeah. And it's actually taken a year to have this under our belt, but I think we've just exploded. Our training portal has just gone crazy in the past like 3 months. A lot of the people who've signed up for the training are high school teachers telling their students, these are chapter leaders of HOSA, Health Occupation Students of America, and they're making their students take this training, whether or not they go on to be caregivers.
Yes, and that's a great point. Thank you. Is that, our original intention was to build our registry, and that still is our intention because we want to expand the pool of trained respite care workers so that family caregivers can find them, access them, and hire them. But what's also happened is we're helping employers onboard their staff. They can take this training, and it's no cost to them, so it's onboarding staff. There's technical colleges that are using this as part of their geriatric programs. This is a requirement in technical schools. So the way that this gets used is just, again, it's exponential. You just never know where it's going to get tapped into. So just getting the word out is so key. But if you build it, it will happen.
I want to just add another group that we didn't think of originally that became a target audience is actually family caregivers themselves. So they have, especially those who self-direct, have the ability to use it to train people they are hiring or want family members they want to provide respite informally. So again, the sky's the limit for how you apply and market the training, but we've gotten really good feedback from a broad sector of individuals who have used it.
And I think on the rack card, we've got info at links so that if you have any questions, you're interested, we can do a Zoom call with your team, we can do a one-on-one, whatever you want. If you just want to problem solve or just troubleshoots or just brainstorm ideas, we're happy to do that with you.
We have time for one more question. And then you can hunt us down at lunch.
Jill has to
And
pick.
there's 5 hands up.
Jill gets to pick.
Okay, rock, paper, scissors.
Are you planning ever to have a national registry?
Oh, us? Well, that could be another 3-year project.
Well, and we had worked really hard with you guys to do this in Oklahoma, but then our leadership said no because of the registry piece. And then looking through this today, I was like, well, why couldn't I promote it through my coalition, through Oklahoma? And then you guys have a search engine that has a drop down of completed. Just my thought. It would remove the barrier for Oklahoma, and we'd be all in.
I kind of missed that part. So the training is when the registry.
So to clarify, she's asking if states are struggling with getting approval to do a registry, which often the barrier is liability,
Right.
because who's going to background check all these people, all that, could we do a national registry? And so on the Arch website, there's a national registry for respite programs, but not individual providers. So that would be something to explore, but I look at Lori like hiding and ducking because she's probably scared of that thought.
Well, and I will add. I will add that because each state has its own laws. So even in Wisconsin, that we've worked through with legal and have made it so that the registry can be a day-long topic right there. So the way of national, let's say there was an issue that came up, arbitration would be what state? So there's just logistical issues in regards to legal terms that could play an issue that could possibly be worked out, but that's kind of where it's at right now. So that would be something that could be explored, but we'd have to get any of the states at the national level to agree legally on that.
A potential workaround to that, I know I'm a nurse by training and have done some private duty home care nursing, and there's a lot of social media groups that kind of serve as registries informally for families. So if you could get a community partner or a random caregiver to start a Facebook group, for example, that's respite providers for whatever area you're serving, you could do sort of a referral to that, but it couldn't be it wouldn't be your group. But yeah, that's a barrier for some states.
So then you could create a national registry of connection.
Yes, yeah, great suggestion. Okay, so it sounds like there's lots of people with more questions, comments, so come find Lisa and I during breaks and lunch, and please use the toolkit, help promote it, use the existing free training, again, available in English and Spanish. It's there, it's done, send people to it. But if you're interested in developing your own state-specific or agency or regional-specific version of the national training, come talk to us about how to use the toolkit to make that happen. So thank you so much. And thank you to ACL for funding the project.
We could not have had better partners on this project, so thank you, Kim, thank you, Lisa, thank you, everyone at Respite Care Association of Wisconsin, and our partners at the National Academy for State Health Policy, too, who have been incredibly supportive through the whole process of developing and promoting the training. We do have a break scheduled for now. I do want you to know that we're relatively informal here, so if you need to get up at any point to take a short break, please feel free to do that. But we will take a formal break now for about 10 minutes and come back at 10:45.